One important issue is taking a backseat in recent weeks, and we're talking about COVID.
So where do we stand, and what still needs to be done is both Moderna and Pfizer have come out with new boosters specifically aimed at the Omicron variants of the virus. So here to tell us about it is Moderna's Chief Medical Officer, Dr. Paul Burton. Good morning, Dr. Burton. Thanks for being with us.
Good morning. Thanks for having me.
Yeah, so a lot of people have questions about this. What is the significance of this new booster, the one that's more targeted? Because if there are people that are already up to date and already had their most recent booster before that, they're wondering, should I get this new one? And if so, when?
Yeah, absolutely. Look, this is a virus that we know continues to mutate and moves on. We're going into fall now, into winter, and we know that cases are going to rise. The booster that we've all had, many of us have had, is very effective. But as I say, the virus has moved on. So we now have a new updated booster vaccine. It's targeted against this new circulating Omicron strain. If we get it now, get boosted, it'll give everybody great protection, I think, for the coming winter.
All right, well, so you've only had FDA emergency authorization for the new booster for about a month. I mean, how is it going in terms of people seeing the need to actually getting the shot?
So far in America, about 4 million people, a bit over 4 million people have been boosted with these new booster vaccines. So there's clearly a long way to go. I think, as you said, people want to put COVID behind us, but the reality is it's here to stay. And we're going into winter, one that could be a bad flu season as well. So there's a real need for people to get boosted. We have great updated vaccines now.
So if you've had the two boosters already prior to this targeted one, should you now get this fifth shot, like a third booster?
Yes, absolutely, because again, this is a virus that continues to change. There's new even variants on the horizon. If you were boosted, say, any more than 3 months ago, or you had COVID more than 3 months ago, now is the time to get the updated booster vaccine.
Okay.
All right, so I guess the question is COVID-19 going to be another disease for which we're going to need those regular shots, like we get flu shots?
Yeah. Look, we're never going to get rid of COVID-19 as a virus, I think. It will continue to mutate, and it will cause disease. So we believe, and many other people around the world think, that indeed we're going to need a booster. We're going to need it every winter. And we're trying to make these updated booster vaccines so they really tackle that strain that's coming along. But a yearly booster seems to be likely.
Yeah, and a lot of our kids, that's the big question now, are in schools where there's no masks being worn anymore, a lot of the restrictions being lifted. So how soon will a booster be available for children?
Yeah, so we've applied for authorization even with this updated booster vaccine for kids down to about 6. We're testing it as well, seeing how we can use it even in the youngest kids as well. So I would think later this autumn they'll be eligible for that too. And as you say, it's really important to keep those little guys safe.
Mm-hmm.
Yeah, I mean, we keep hearing so much about mutations. I mean, what's your response to people who at this point are still refusing to get vaccinated? Some saying that vaccines are dangerous.
Well, look, we've used our vaccine alone in over 800 million people around the world. 800 million. It's extremely safe, highly effective, protects people against severe disease, protects people against infection. And now that we have this updated vaccine that's targeted against the circulating strain, it makes good sense. Get protected, get boosted for the autumn, for the winter. It'll keep everybody safe, you and your loved ones.
All right, so let's talk about this technique. I mean, harnessing messenger RNA, relatively new. It's a material that helps us make proteins, to create proteins that trigger immune response, that actually trains your immune response to recognize the COVID vaccine. Here's a question. Is it going to be used to make vaccines for other kind of ailments, or are we still far away from that?
No, that's a great question. So certainly at Moderna, we're testing mRNA, which all of our cells make. It's a completely natural molecule that is in all of our cells. We're using mRNA for cytomegalovirus, leading cause of birth defects, other respiratory illnesses as well, including flu. So we're testing it for many, many diseases. And I really think it's going to be a foundation for new medicines here in America and around the world for decades to come.
Yeah, while we have you here, we do want to ask you, Moderna is suing Pfizer for allegedly infringing on its patients. Can you tell us why that suit was filed after we've had the Pfizer vaccine for almost 2 years?
Yeah, look, as Chief Medical Officer, I'm qualified really to talk about medicine and science. I can tell you that we're very confident in the actions that the lawyers are taking. But, again, my message is, look, this is a virus that won't go away. Get boosted now if you can, get protected.
All right, Dr. Burton, thank you so much for taking the time to speak with us this morning. We appreciate it.
Thank you. Thanks for having me.
Thank you, sir.